Welcome to Chapter 7. We are going to discuss diversity this week. I love diversity. I have grown so much from working in a very diverse healthcare arena, and I find my most positive outcomes come from diverse ideas, diverse people, diverse interdisciplinary teams, etc. So I Googled a few diversity quotes. These are my favorite. Strength lies in differences, not in similarities. That is so true. The beauty of the world lies in the diversity of its people. And my last one that I really like, we are all different, which is great because we are all unique. Without diversity, life would be very boring. And on that note, healthcare would not be as magnificent as it is if we were not diverse. So we are diverse, we should be diverse, and I hope that I can help you learn how to embrace that. Okay, so the book, chapter 7, starts on page 119. The learning objectives are listed there. Teams reflect the thriving diversity within communities. The amount of outward appearance of diversity varies, and that's perfectly great. So this slide speaks to the table on page 120, Mannix and Neal's diversity categories. And yes, we can find so much diversity within these. Factors influencing worldview. There are, of course, there's social factors, psychological, economic, and culture. All the aspects of diversity are salient to the interprofessional healthcare teams and have been classified at surface level or deep level. Let me make sure my slides align here. Okay, so I think these are just going back and forth. Okay, so if I'm following along with the slides, professional or disciplinary culture influences the individual's view of who is considered part of the team, influences perception of status and roles of team members. And so what this is referring to is certain teams or people may perceive someone, for example, like a physician, a medical doctor being the hierarchy of a team. But if you're attending a healthcare team rounds on a patient who is in the hospital just for physical therapy or rehab, then during that meeting, that team group, actually the physical therapist and the occupational therapist would be the most important person in the room. So that's where we get our diversity from in regards to this. Let me see what the next slide is. Characteristics of high performing teams. I feel like we skipped something, so bear with me as I peek through these next slides. Environmentally safe. Yeah, okay, that's okay. All right, so it's going a little bit backwards, and that's okay. All right, so we talked about the professional and disciplinary culture influences perceptions of teams' purpose and responsibilities. There are certain team meetings within healthcare where your hierarchy or your rank, it's not what one may think. It depends on what the purpose of the meeting is and the objectives with that certain patient group. Characteristics of high performing teams, yes to all of this. Open communication, reflection, respect, especially in diverse groups. Sometimes we can relax, if you will, if you're in a group of people who look like you, sound like you, feel the same way you do. We can almost be silly, we can what have you, but when you are in a team working in groups within healthcare and you're in a room full of people that are very, very, very different, you must respect them. That would definitely not be a time for a joke, any kind of unprofessional behavior, etc. Continuous learning, absolutely. High performing teams are always aiming to learn something. To me, I think I've said this before on one of my lectures, but one of the most dangerous types of people in the world is someone who thinks they know it all and don't seek further learning. So, continuous learning is a great characteristic of high performing teams. Recognize interdependence of members. Yes. Psychological safety. This is a very, very important topic and idea, and it is throughout your book on page. I'm not going to be able to find it right away, but I'll come back to this. But I want to get to the next slides. Okay, so now I feel like I'm back on track. So here, diversity levels. I'm back on page 120, 121. Surface level diversity and deep level diversity. So, surface level diversity or demographic diversity can be defined as attributes that are physical, not easily changeable, and almost immediately observable. So, this includes age, race, ethnicity, genders. Those are all considered surface diversity. And continue reading that paragraph on 121. Deep level diversity. This is professional training and strength. It's professional identity. It often is reinforced by personality, values, and attitudes that that influence an individual's choice of profession. So individual variation, these factors impact professional behavior. So the example it gives in the book, primary physician's primary responsibility is the health and well-being of the patient, while a senior administrator at the healthcare facility is responsible for the entire health system. So both roles are legitimate, but they're very different in nature. Same thing with doctor versus nurse, or nurse versus physical therapist, dental hygienist versus dental assistant, pharmacist versus pharmacy tech. We can apply that deep level diversity throughout every healthcare team. Unconscious bias. This is a great section in this chapter. So, first and foremost, we are humans. We have natural biases. It's okay. It's normal. Where it does not become okay is when we use those biases to be harmful. So perceptions and reactions outside of our conscious control. This is a real thing, and your book does a great job explaining this unconscious bias. I am not gonna go into it more because I don't want to put my own bias. I don't want to put my own spin on this. Page 122, I did highlight when we encounter another human being, we implicitly and automatically make judgments about that person, and our biases can blind us. We do make assumptions about people, we assess our situations that we're in, we assess, and it's completely normal, natural, and it's a defense mechanism. It's how we handle ourselves in a given situation. Okay, 122, mitigating unconscious bias. We all know that beings have biases. The brain is wired for self protection, and unconscious bias leads to prejudice and poor decision making. It can. So you have to mitigate that. You have to control that, especially in a healthcare setting. Accept the presence of bias, name the bias, create inclusive norms for this group of people that you're working with and taking care of, and facilitate collaboration, shared decision making. You can do this. There are strategies. Page 123 goes into that. Your individual healthcare facility systems will have a diversity and inclusion team, as almost all, nah, maybe not all of them yet, but we're all going to get there. And you work with these people and you grow individually. It's just a good thing to embrace diversity, learn more from it, and learn more about your own biases and how to mitigate them, how to handle them. Um, and that's where I'll stop with this. Okay, page 123, opportunities to leverage interprofessional team diversity. Definitely in the early stages of teamwork, you can get more done if you're more likely to work with someone who is like you. But that's in the early stages of forming a group. But I'm here to tell you, long term, diversity is where it's at. Having a very diverse group to make decisions. Okay. The need for a complex array of services such as medical, therapeutic, pharmaceutical, nutritional, pastoral, as well as clerical, data management, transportation, infection control, medicine supplies. Um, all these stakeholders within this healthcare system are diverse. And not only their professional roles are diverse, but the human beings doing this type of work, they are diverse also. I highlighted on page 125 also high staff turnover presents a challenge for those who would attempt to develop strong healthcare teams. Absolutely. It's not easy leveraging diversity or even building a healthcare team. It takes practice, it takes skill, So here's my psychological safety highlight. It was on page 126. We were at a previous slide. I'm not going to flip it back. But psychological safety, what that means in a school environment, healthcare environment, work environment, it's an important factor because you are able to speak your mind in a professional, appropriate way, of course, but you should always have that psychological safety to be able to go to a leader and say, this is how I feel. I would like help with this. And nobody should put you down. Nobody should say, oh, it is the way it is. This is something that you want to change behaviors, you want to bridge gaps, and you should be able to report yourself or report something you see. It goes back to that culturally accepted, if you see something, say something. But a psychologically safe work environment is an important factor in staff retention, and it mitigates the risk associated with behaviors that bridge status differentials, such as suggesting new procedures, offering unsolicited feedback, sharing innovative ideas. So that's just important to keep in mind with healthcare teams. All right, let me see if I can get caught up with this slide now. Page 127, open inquiry, listening deeply. That's not what it says, but that's how my mind perceived it, and creativity in teams. So that's a great page, great paragraph or section there. Comfort with not knowing. This is this is so important. This is very important in healthcare. I believe the book goes on to explain that many artists have this comfort and not knowing, and it is referred to as negative capability. So, what does that mean? Okay, so with the opposite, positive capability in the form of skill development in areas such as clinical expertise, clinical decision making, that's important competencies. Yes, the positive capability. But on the opposite side, comfort with not knowing and the capability to predisposes one to being open to new ideas, seeing things with new eyes is termed negative capability. So it's actually an oxymoron in my opinion, because negative, the word negative has a poor connotation to it. But this is a good idea. So let me reiterate this. When you have negative capability, you are able to have an open idea about something that allows creativity, that allows diversity, that allows inclusiveness. And then you can see things through a different view. Again, negative capability. So health professionals who have negative capability are more comfortable working in ambiguous spaces between disciplines, so between doctors, pharmacists, nurses, physical therapists, and are more likely to elicit innovative thought and creative solutions. So this is a good thing. Okay, so I stayed on the slide, positive capability. Yes, skill development, clinical expertise, clinical decision making, but this negative capability, this is where it's at. This is where the innovation, the creativity, and everything, it flows, because these people, if you are minded that way, you're kind of open and figuring out different things that we could do. So deep listening is refocusing our attention on others. Um, Actually, deep listening, active listening takes practice. You ask questions rather than making your own statements, especially with diversity. Oh, yeah, definitely with diversity. Do not make a statement regarding somebody's diverse factors. Ask questions. Ask questions about people's religion, their beliefs, their values, their instead of making statements for sure. Transforming spaces of conflict to new spaces of learning. You can definitely do that with deep listening. Oh, and this is our last slide. Managing conflict. Yes, so there's a great section. Page 128 in the book, by the way, Bridging Gaps. That's a great paragraph. Page 129. This is where we're at. This is the end of the chapter. Managing conflict. Health professionals also often find themselves in positions that require negotiations. This can be with peers, superiors, subordinates, your team members. Successful patient outcomes depend on health professionals' ability to adjust their views to accommodate the views of others. Look at there. Bottom of page 130 is what I'm reading from. Yeah, so that's it. So again, in summary, diversity is a fabulous thing. I prefer to be in a workspace of diversity. I even prefer to be in a community of diversity around my hometown. I prefer to be in restaurants, stores, um, churches, everywhere I go, the hospitals I work in, I want them to be diverse. There is so much value in diversity. We just have to manage our natural biases and have an open mind and want to learn from others. Okay, please let me know if you have any questions.